I wanted to talk to you about the Medicaid work requirements that were just recently passed in Kentucky. And yes, other states have also filed waivers. It's Waiver 1115. Altogether, 10 states have filed for approval for work programs for their Medicaid recipients. And I just kind of wanted to overview it. So basically, Kentucky actually filed their waiver paperwork last year. So it is something they've actually been wanting to do for a little while now. But they're targeting adults who are 19 to 64 years of age. And they're requiring them to do 80 hours per month of community engagement activities. And these activities include anything that can be work related, such as school, volunteer, job training, or any other approved activity. And these changes are supposed to go into effect on July 1st of this year. Now, there are exceptions to some of those. So, individuals who are primary caregivers, medically frail individuals, pregnant women, or former foster care youth, there are some exceptions to this new mandate. So with this, they're really projecting to reduce the number of Medicaid recipients by 95,000 individuals in the next 5 years. And it's a really big deal because, I mean, some people are going to be losing coverage completely. Other people may still have medical coverage, but may lose their dental or vision coverage. So really just kind of keep up to date on all these things. There are, again, 9 other states that have filed this waiver that are waiting on approval and kind of seeing how everything's going with Kentucky. These other states that have filed include Arkansas, Arizona, Indiana, Kansas, Maine, New Hampshire and North Carolina, Utah, and Wisconsin. So again, in all, 10 states have filed for this work requirement approval program. And what I also want to point out is, I mean, obviously there's been a lot of criticism over this program, and some of that comes from how it's literally already paving the way for more and more changes. There have already been 3 additional major changes that have been approved even after Kentucky got their approval for their program here. So in addition to this, the Trump administration has already approved for Kentucky to impose premiums on its Medicaid recipients. These premiums are going to range between $1 and $15, and it is income based. So they're saying that if you have an income of $3,000 or less a month, that you're going to be in that kind of $1 a month premium range. But if you're making between $12,000 and $15,000 a year, you're going to be up in that $15 a month premium range. The second thing that they have imposed, and this is where it gets kind of scary for people, is it's called a 6-month lockout. Pretty much, if you fail to pay, and this is the population they say that's going to be between that $12,000 to $15,000 a year salary range. If you fail to pay your premiums, then you can lose your coverage and you will not be able to reapply for coverage for 6 months. Now, once your new re-enrollment period comes up, if you fail to apply for coverage again, then you can potentially lose the ability to get coverage for another 6 months unless you take a financial or health literacy class. Now, I think financial and health literacy classes are important in the first place because it's always nice to be educated on everything and to know what's going on. But it's scary because people are going to lose their coverage or potentially lose their coverage. And it's all because if they fail to pay something that they've apparently never had to pay before. And these are people who are already financially strapped. Otherwise, they wouldn't be going and applying and getting approved for Medicaid. So moving on though, and this kind of goes, the third thing that got approved goes along with those reduced coverages And there's not going to be any more non-emergency medical transportation covered under the Medicaid program. That's a really big deal because, again, a lot of people rely on transportation to and from even just regular doctor's appointments or preventive care appointments or therapy. So everyone just kind of keep your eyes open, your ears open, stay up to date on all these changes. Again, these other states are kind of looking at Kentucky to see what's happening and what's going on. So I'm going to go ahead and keep making these videos. I hope this was helpful. If it was, give me a thumbs up. Come subscribe to my channel. I'm going to be making a video next about if Trump's going to eliminate the Cadillac tax. And no, I don't mean a car, but stay well.